All right, let's talk about something you probably see all the time in your practice, anemia. But we're going to look at it a little differently today. Think of it less as a single, one-size-fits-all diagnosis and more like a tale of three completely different patients. Each one has their own story, and each one needs their own unique therapeutic approach. So let's dive right in.
So here's the big question, right? Is anemia just anemia? A set of numbers on a lab report? Or is it something more? Is it actually a whole bunch of different stories, where the patient's personal experience is the real key to figuring out what's happening? Well, as we're about to see, the answer is definitely in the story. And that idea leads us straight to this core concept, individualization. This isn't about just slapping a label on a disease. It's about matching the right remedy to the person. It means you've got to look at the whole picture, what we call the totality of symptoms. We're talking about everything, the root cause, the physical stuff you can actually see, and even their mental and emotional state. Suddenly, the why and the how of their illness become way more important than just the what.
Okay, so how do we start building that complete picture? Well, it all starts with the origin story. We have to figure out what kicked this whole thing off. What was the specific event that triggered the anemia?
So for our purposes today, we're going to zero in on three classic patient profiles, each based on a different origin. First up, you've got the patient who is just physically worn out from overexertion. Then there's the patient whose anemia comes from some kind of toxic influence. Think malaria, for example. And finally, we have the patient who's lost a significant amount of vital fluids, maybe from a hemorrhage or severe diarrhea. As you'll see, these three starting points create three totally different paths.
All right, let's get into the first layer of clues, the stuff you can see just by looking at your patient. How do these different origins actually show up on the outside? What are the physical signs that start to separate these stories from one another?
And wow, look at how clear the differences are when you lay them out like this. Your overexerted patient, they just have this general paleness, looking completely worn out. But then you look at the patient with a toxic influence, completely different story. Their complexion might be earthy, waxy, even a bit greenish. And you see that extreme prostration and obvious puffiness or edema. Then you've got the fluid loss patient. They often have more of a sallow look, along with their exhaustion, and some puffiness, especially in their hands and feet. It's amazing. The origin story is practically written right on their face.
And hey, sometimes the clues aren't so obvious. They can be subtle and they can be quick. Take this observation here. A deceptive appearance, full-bloodedness followed by paleness. You might see a patient who looks flushed for a second, but then it just drains away into paleness. That's a huge clue. It's a great reminder that you have to be really observant. It's not just a snapshot. It's about watching the patient over time.
Okay, so we've covered the outside signs. Now, let's go deeper. Let's talk about the patient's internal world, what they're actually feeling. This is where we get into those unique states and sensitivities, what we often call modalities. And this is where these three profiles really truly start to diverge. Now, this is the stuff you can only find out by talking to your patient, right? And these clues are what point us to the right remedy. Take the overexerted patient. This profile points towards Helonias. And get this, they actually feel better when they're busy and their mind is distracted. How interesting is that? Then you have the toxic origin patient, which lines up with arsenicum, and they're dealing with this deep, extreme anxiety. And finally, the fluid loss patient, whose profile matches Cinchona. They're often incredibly sensitive to their environment. Like even a slight draft of air can bother them. These internal experiences are just massive clues.
Let's just pause on those two mental states for a second, because the contrast is incredible. On one side, you have someone who feels better when they're distracted. That's a huge neon sign pointing to an origin of overexertion. But on the other side, you've got a patient whose physical exhaustion is cranked up to 11 by this intense, all-consuming anxiety. That tells you there's a much deeper, probably toxic, process going on.
Okay, this is where it all comes together. We've collected all the clues, the origin story, the physical signs, those internal feelings. Now let's put the pieces of the puzzle together and see the complete picture for each of our three patients.
So, here's our first clear match. Simple as this. If the problem started with physical overexertion, and the patient tells you they feel better when they're busy, then the picture is pointing straight to Helonias. See how that works? All right, let's look at our second profile. If the whole thing started after a loss of vital fluids, and you see that sallow complexion and they mention being super sensitive to drafts, then the story they're telling you is a perfect match for Cinchona.
And for our final case, if the root cause is some kind of toxic influence, and the picture is dominated by that extreme anxiety, the total exhaustion, and that intense thirst,
then every clue in the story points us towards arsenicum. So there you have it. 3 totally different stories, leading down 3 very clear therapeutic paths.
So, to wrap things up, what are the big takeaways here? First, the origin story is your #1 clue. Always start there. Second, the patient's physical appearance tells you so much about what's really going on. Third, don't forget their mental state and sensitivities. Those are your key differentiators. And it all boils down to this. A great therapeutic match comes from understanding that complete, individual picture, the totality of symptoms.
And that leaves us with one final question to think about. What happens when we make this shift in our own practice? How does it change things when we start seeing each patient not as a case to be solved, but as a unique story that needs to be heard? It's something worth thinking about, for sure.